Hi, I'm Dr. Errol Billinkoff. Choosing to have a vasectomy is a major decision in most men's lives and often requires considerable thought. I'm hoping that my website will help you get the information you need before taking that final step. If you or your partner are watching this video, then you are probably considering the Billinkoff Vasectomy Center. I'm going to explain to you why this is the place you should go to have your vasectomy. First and foremost is experience. I was one of the first doctors in Canada to offer the no-scalpel vasectomy back in 1992. Since then, I have performed over 28,000 vasectomies. Very few doctors worldwide have done this many. The second reason is technique. The no-needle, no-scalpel vasectomy, which is the technique that I use, is the state-of-the-art technique for performing a vasectomy. No other form of permanent birth control has as high a success rate and as low a complication rate. It is the clear choice over tubal ligation and is the reason why so many women encourage their partners to have a vasectomy. The third reason to have your vasectomy here is comfort and convenience. Over all these years, I have refined every step of the process from start to finish. Although vasectomies are insured by provincial health, I offer a premium package to cover the cost of services that greatly improve your overall experience. With the premium package, you get all of these services. The no-needle spray anesthetic is used rather than the needle injection, and this puts people's minds at ease and improves patient comfort. With the premium package, you can get everything done in just one visit. No pre-op or post-op visits required. Before surgery, get approved by completing a questionnaire rather than coming in for an office visit. After surgery, I recommend sperm samples after 3 and 4 months. With the premium package, you can get your results on our website rather than having to return to the office to get them. We do not give out results on the phone or by email. The premium package saves you the inconvenience of having 3 extra office appointments. You can also choose any available appointment online for your vasectomy. Timing is everything, and you get to choose the day directly from our schedule. With basic coverage, you will be offered the next available appointment. These are just some of the improved services and features that you will receive with the premium package. No needle, no scalpel, no incision, no stitches, only one office visit, and the operation usually takes less than 10 minutes. I could tell you how quick and easy it is, but I will leave that to your friends, relatives, and co-workers who have been here. No matter where you live in Manitoba, Western Ontario, parts of Saskatchewan, or Nunavut, you probably won't have to look very far to find one. About 1/3 of my patients come from outside of Winnipeg. By now I'm sure you realize that vasectomies are what I do, so why would you go anywhere else? And now I will explain the steps you should take to get started in the process of having a vasectomy. Step 1 is to create a new account. It is important to remember which email address you use, as this is the same email that must later be used to book your vasectomy. Step 2 is to decide between the basic and premium packages. These are explained in detail on this website. Step number 3. All patients must get approved before booking an appointment for their vasectomy. With the basic package, this is done by calling my office and making an appointment for a consultation. With the premium package, this is done by completing my online questionnaire. Once I've reviewed the questionnaire, I notify patients by email if they are approved for surgery. In some cases, getting approved from the questionnaire may not be that straightforward, and an office appointment may be required to discuss or clarify an issue. If you are young, not in a stable relationship, and have no children. If you are a fainter, you might be better off having it done in hospital. If you are on blood thinners such as aspirin or Coumadin, this would need to be stopped before your surgery. If you have had previous surgery for an undescended testicle as an infant, or if you are very overweight. In either case, it may be challenging for me to find your tubes, making a vasectomy difficult or impossible to do. Examining you first would give me a much better idea if it would be possible to get the job done. Once you are approved, all appointments for the vasectomy are booked online. If after reviewing this website and watching my video you have a question or are unclear about anything, please contact my office for clarification. I only work part-time, so my clinic hours are limited. Please be aware that when I am not at work, the office is closed and my receptionist works remotely. We appreciate your patience with replying to your inquiries. To understand how a vasectomy works, let's review the anatomy of the male reproductive system. Sperm cells are produced in the testes and then are stored for about 2 months in the epididymis gland where they mature. During intercourse, muscle contractions move the sperm from the epididymis gland through a tube-like structure called the vas deferens. As the sperm travel through the vas deferens, they mix with semen produced in the seminal vesicle and the prostate gland. When orgasm occurs, sperm and semen are moved together through the urethra and are eventually ejaculated through the end of the penis. With a vasectomy, a section of vas is usually removed and the ends are blocked in various ways to prevent sperm cells from getting through. Unlike this video, I only apply a single clip to block off each vas. The no-scalpel procedure allows the surgeon to get to the tubes without incisions. An anesthetic spray is used to freeze the skin in both vas deferens. Next, the tubes are located just under the skin of the scrotum. A specially designed instrument is used to grasp the tube in the middle of the scrotum, while a sharp-tipped instrument is used to pierce the skin, then gently stretch a small opening through which the first tube can be exposed. The vas is lifted out and blocked through this opening. Then the second tube is lifted out, then blocked through the same small opening. No stitches are needed to close the tiny wound, which usually heals in 5 to 7 days. Imagine that these sections of cable represent the vas with the lower end attached to the testicle. There is an outer sheath and an inner tube, or a tube within a tube. I first make a slit in the outer sheath, exposing the tissue overlying the vas. This tissue contains tiny veins and is stripped away, exposing a small section of vas seen here in white. I cut out a half-piece inch of vas. I cauterize the vas ends, then drop them back inside the sheath. To make sure that the two ends never grow back together, I keep them separated by pinching the sheath between the two ends of the vas and keeping them separate by crimping the sheath with a titanium clip. This creates a permanent barrier between the two ends and reduces the chances of them growing back together. And no, they won't set off the metal detector at the airport. This is an example of the small clip that I use to pinch the sheath between the two ends of the vas, which stays in permanently without any problems. By far the most common concern expressed by patients about having a vasectomy was a fear of getting this needle. In fact, some patients were downright terrified about it. Along came the more comfortable technique for freezing the skin and the tubes. A device that contains the same liquid anesthetic as was used before in the needle is instead placed in a spray applicator. This device simply squirts the liquid into the skin. By holding the tube right up underneath the skin, enough liquid gets through the skin to freeze the tube as well. This simple method eliminates the fear and pain of the needle and works equally well. The freezing works within a minute. Only an area the size of a dime is frozen, which is where the tiny opening is made. Once the freezing has taken effect, the operation is virtually painless. The freezing lasts for about 2 hours. Patients do not notice any difference when the freezing has worn off. Those who are driving several hours to return home should not expect to have any problems. Patients can drive themselves home from their surgery. Many patients ask if they have to take it easy for a whole week. Aren't 4 or 5 days good enough? Well, for some patients they are, but for others it's just too soon. It's impossible to know who will need longer to heal. If your work or recreational activities involve standing, lifting, or straining, you should arrange to avoid those activities for a full 7 days. If you return to those activities before a week, you are increasing the risk of becoming swollen and sore. Any sexual activity should also be avoided for 1 week. Climbing a modest number of stairs is not a problem. I am frequently asked about working out or other exercise. Although virtually all patients are advised to resume their normal work activities after 1 week, I still think it's a good idea to avoid sports, working out, and other unnecessary activities like snow shoveling for a period of 2 weeks after, just to be safe. It is not unusual to feel a little sore in the days following a vasectomy, but you should not be in pain. The key to an easy recovery is to prevent swelling by avoiding prolonged standing, which is more than 20 minutes at a time, applying lots of ice or frozen peas, and using an anti-inflammatory pill such as Advil if needed. I strongly recommend not having a vasectomy before a planned trip or vacation. Although complications are rare, you definitely don't want to have a problem while you're in Mexico with the family or during a ski vacation. If you have any travel plans in the future, I suggest having the vasectomy after you travel and not before. And lastly, if your wife is expecting, and especially if it is a planned pregnancy, I always recommend waiting until after the birth of the baby before going ahead with the vasectomy. The reason, of course, is that no matter how smoothly previous deliveries may have gone for you, you never know what might happen. Given the worst case scenario where the baby might not survive, a couple might want to try again. Obviously, having a vasectomy first would make this difficult or impossible. It is quite normal for there to be sperm still present for several weeks or months following the vasectomy, so it is very important that you use another form of birth control until a sperm sample shows that there is no live sperm remaining in the ejaculate. If you live outside of Winnipeg, your sample can usually be taken to a local lab or hospital instead of having to bring it to Winnipeg. I recommend that you drop off your first sample after 3 months and then a second sample 1 month after the first one, just to be absolutely certain that there is no more sperm left. If both samples show that there is no live sperm, you may discontinue all other forms of contraception. Your operation has been a success. By now, I think you can understand why more men in Canada have had a vasectomy than women have had tubal ligations, and why more men have had their vasectomies at the Billinkoff Vasectomy Centre than anywhere else in Western Canada. And don't forget, in the time it took to watch this video, you could have had a no needle, no scalpel vasectomy.